These are troubled times and people are feeling it. But the antidote to that pessimism, this research found, is
how can a set of skills lead you down the path to success? That's what we're setting out to answer on the Ed Up Canada podcast. I'm your host, Michael Sangster. Join me as we unpack how leaders around the world have taken training and skills and turned that into a lasting career. Now let's learn together. Welcome back to the Ed Up Canada podcast. I'm Michael Sangster, your host, and I'm excited here for our episode today where we're going to delve into the intersection of business and compassion with our special guest, Kimberly Hanson, CEO of Health Partners. I hope you'll join us as we explore opportunities for collaboration between employers and health charities, uncovering strategies that not only cultivate healthier workplaces, but also ignite hope, resilience, and well-being within our communities. I'm honored to be on the board of directors and acting in the role as vice chair of Health Partners. And I asked Kimberly to join us because she's an inspired leader who's changing the organization, bringing a fresh approach to everything we do, and having an impact. And with that, Kim, welcome.
Thank you, Michael. I'm really glad to be here.
We do like to let everybody introduce themselves for a minute or so. There's no point me reading your resume. Tell me about you.
My name's Kim Hanson. I am the Chief Executive Officer of Health Partners and really proud to be here because I'm passionate about health charities, the impact they have on Canadians and our healthcare system, and I'm always keen to be able to give back. I come to Health Partners having worked in the health charity space for a number of years, both as a consultant at Hill & Knowlton and as head of advocacy at Diabetes Canada. And before that, I had many years working in a variety of functions in financial services.
You're one of those people in town I knew of but didn't know before we got connected at the board of Health Partners, but we've got that army of shared friends.
I always say that I'm the only person in Ottawa who didn't know Michael Sangster before I got here.
I don't think that's true. There are a few police officers I have not met yet. But I'm working my way through it. I am working my way through the list. So tell me, your role. Why did you take on this role after the other things you did? This is a big change.
It is a big change, and it wasn't one that I was instantly sold on. I loved the work I was doing when the Health Partners opportunity came knocking. But when I thought about it, I thought I believe very deeply in the role that patient organizations play in supporting Canadians that are living with chronic or acute medical conditions and or their caregivers. I really believe in the role that they play, and I believe that they need every dollar of support that they can get. And so Health Partners has a really important and unique mission as the only organization raising money through workplace giving for national health charities. And we do so for a coalition of 17 really important, impactful health charities. And so the opportunity to come in and try to make a difference by bringing Health Partners to the next level was so compelling to me as a way to give back.
You've got a mix of small and large health charities. Last year, you added a mental health organization. Maybe give people a little bit of the depth of the kind of organizations that you're working with. Don't name all 17. We only have a half hour.
I will not. You have to go to our website to find out all 17. But I'm actually incredibly proud of the mix of charity members that we have at Health Partners. We were founded at the sort of initiation of the Canadian Cancer Society, who remain a valued member. We have some of the biggies, heart and stroke, diabetes. But as you said, we also have some really important rarer diseases or smaller charity organizations like ALS, Parkinson, Huntington, hemophilia. And the combination is sort of magic. It's a really great example of where the value of something is equal to more than the sum of its parts.
Before we dance around to some other topics, we have employers that listen. We have government leaders who listen to the podcast. At least they tell me they do. I should quiz them with some questions at the end. But give me an idea how an employer or government can support health charities by working through health partners, because I don't think people are aware of your organization and what you do.
I think that's a great question, Michael. And I think you're right. Lots of people don't know us. So thank you for it. Employers can actively support health charities in lots of ways. But the one I'd like to focus on is as simple as holding a workplace giving campaign. So, a workplace giving campaign is where the employer welcomes employees of that organization to give donations to a charity or charities of their choice if they wish. And oftentimes, the employer will make payroll deductions available or let people donate vacation time, but it's really a voluntary thing. And so, why would an employer want to do that, you might ask? Well, there's some really interesting, compelling recent data about that. A poll that was done last month by Imagine Canada shows that people are feeling less hopeful about the future than before. These are troubled times and people are feeling it. But the antidote to that pessimism, this research found, is fostering personal connections and helping others. People really want to have a sense of community, even at work. And that kind of help is needed more than ever because demand for charities services has nearly doubled since last year alone. But at the same time, donations are down, and that means that charities are having to reduce programs and services. So charities need support more than ever. Employers can give their employees the optimism and sense of community that they crave by hosting workplace giving campaigns. And it gets even better because a post-pandemic survey found that when people had a sense of community at work, they were 58% more likely to thrive at work, 55% more engaged, and 66% more likely to stay with their organization. That all turns into benefit to your bottom line. So lots of benefits to employers in making it possible for their colleagues, their employees to donate to health charities and give them the support that they desperately need right now to keep helping Canadians.
And it's not just research that they work on operational issues as well. So it's also about making sure we have a healthier Canada, just in general, too.
You're so right, Michael. Health Partners members funded $107 million of health research in Canada, research into treatments for diseases, ways of preventing them, but also into cures. But they also delivered programs, services, education, and advocacy that directly touched 24.5 million Canadians just last year. That reach and that impact is just enormous. And it goes even further when you think about the knock-on effect on the folks that love the people touched by these chronic and acute medical conditions.
So this is not about health partners today, but our podcast is about leadership. It's about lessons learned. It's about things employers are looking for, governments are looking for, skill sets for young students, learners that are coming up that they might want to look at. And the majority of our students are actually kind of in their 30s. 60% of our learners tend to be women. So it's a different audience. So we like to give them a little bit of a message here from successful people about lessons learned. So I'm going to dive into that part of what we talk about. So let's talk about a skill that helped you remain resilient and adaptable. And as you've made changes in your career, and maybe even touch on that, what's that skill you wish you had now, or you do have now, but you wish you had earlier in your career?
I think the biggest one that I have worked to cultivate as I've gotten a little longer in the tooth and further into my career is...
You mean older?
I do. I'm
Okay.
admitting that I maybe don't fit with the demographic of the 30-year-olds that are in community colleges, unfortunately.
Barely.
But the most important skill, if you will, is that of being really clear on my intentions, what I'm intending to achieve and why, how that connects to my personal values and the values of my organization, but being open and flexible to how that might take shape. Because if I've learned anything in my day, it's that often the path that I set out on turns out not to be the path that gets me to the outcome at the end of the day. So that mixture of like staying connected to your purpose and yet being open and curious about how you might achieve that purpose at the end of the day.
A different perspective than we've heard from anybody else. So thank you for sharing that. You're on the front lines of working with health charities across Canada today. Every single day you're talking to them. I've spoken to a few of them with you. What are those organizations talking about when it comes to the barriers or the skills they're looking for in people who come join their organizations today?
I'll answer in two parts if that's okay, because I'll tell you what our health charity members are struggling with right now, or the sort of trends that they're responding to right now, because I think that that feeds into the traits that they're most looking for in employees in this day and age. And so, health charities have a long, and some of them up to 100 years of history in Canada providing supports to people, but they're more and more they're being called upon for a variety of reasons to do those projects, to deliver those supports in partnerships with other organizations, whether they be other charities, governments, private sector organizations. So those partnerships are more important than ever, and they can be challenging to manage effectively. Health charities are also having to respond to demands for constant innovation. And I don't think that's unique to our sector by any stretch. But what that means is that they're constantly having to reconsider how they're delivering even basic tried and true supports like education. They're having to use a variety of technologies, even artificial intelligence and so on, to deliver more and more personalized, more and more targeted solutions. And so that constant innovation mixed with the growing and perpetual need to do it in partnership with others means that what I'm hearing from our member charities is the skills that they're looking for the most in employees are their engagement, that real passion for the work that the organization does, and their sense of true desire to help the patient community, as well as agility. People have to be able to, it's an overused word, but they've got to be able to pivot and respond to changing trends to keep innovating and delivering effective supports to the communities that our members serve.
That's a important perspective. We had Stephen Murgatroyd on, Dr. Stephen Murgatroyd on recently in the podcast, and he's spoken at a few events for us. And he was talking about a medical trend in England where they were using AI to review all of the, I believe it was eye scans. And they had reduced the time by 90% for reviewing the initial eye scans, and the doctors were performing, I can't remember the number, but it was a quantum increase in the number of surgeries they were performing because they weren't spending their time looking at the eye scans. The computer could do it. They could take a quick look and confirm. And it's quite interesting. The innovation thing is important. So one of the things that I've been lucky in my career, I've been lucky in life, I've had every break in the world. And I've always tried to find a way to give back. Always try and be on a charity board. So I was going to say, is there advice for employers, but maybe even advice for learners out of what they get out of volunteering? What do they get out of philanthropy in developing their own skills?
I think that the opportunity to derive benefit from volunteering is limitless. We think about it as a way of us giving to others, but from all the volunteerism that I've done, I'm sure I have netted more benefits than I have delivered. And I think that those can be really tangible and practical, like learning a new business discipline or a new technical skill that you're required to learn as part of your volunteerism. It can be expanding your network and meeting some other phenomenal people who have values aligned with yours. And as an entrepreneur yourself, you know better than anybody the value of networking and finding those with common goals and values. But it's also that inimitable sense of our great privilege. We are all so lucky to be living here in Canada and to be benefiting from the opportunities that that presents. When I am able to give back and sort of in so doing, be connected to folks that might be struggling more than I am, it's valuable perspective for me and helps me get through more frustrating days or down days by reminding me of how lucky I am.
It's a good point. And we both live here in Ottawa. We're lucky to be here in Ottawa. Maybe share a couple of thoughts about the Government of Canada Workplace Charitable campaign and what that means for health partners as such a major source of funding, but also of partnership.
The Government of Canada Workplace Charitable campaign has been going on for decades. And I don't know that your average Canadian is aware of that campaign, but I kind of wish they were, because it is one of the most inspiring things that I've had the pleasure of being exposed to. Every fall, the federal government invites all federal public servants to contribute to the charity or charities of their choice through their workplace charitable campaign. But the events that they do and hold to come together as a community and to motivate one another are amazing. They go from bake sales to walkathons to apparently there was a deputy minister bug eating contest a couple of years ago. And so the federal public servants that I've had the privilege to meet during the GCWCC over the last year, they are so proud to be working every day on behalf of Canadians. And they all talk about having a real strong sense of their privilege in having those good jobs and the ability to give back to their communities. And so they show up and they participate in events, but more importantly, they dig into their wallets. And even in these challenging economic times, they dug deep. And so the GCWCC apparently last year will have raised more than $28 million for Canadian charities.
It's lost in Ottawa's news. It gets lost. We focus on the bad news.
We focus on the bad. We focus on what people could have done better. And there are always those things. Everything I do, I could have done better in some way. But what they give freely and of their own choice is really inspiring to me. I'm super grateful.
I thought it was important we let that story be told a little bit. Let's get back to skills development, learning. When you talk to your members, do you see a greater role for career education in the sector, for the healthcare sector, as you speak to them? Or do you not even have those kind of conversations because it's not the relationship you have with your charities?
You know, I can't say in all honesty that we've talked about the role of career colleges versus other types of education or skills development approaches. But I will say that, and it relates to the comments I made a few minutes ago, employers are really looking for people that can come with practical skills that allow them to hit the ground running in a role and start delivering value very quickly. And I think that colleges are incredibly adept at making their graduates kind of ready to hit the ground and start adding value right away. And when you add to that mix the, if you will, soft skills, or I prefer to call them more people or character skills that colleges are also helping to foster in their students, like change management or communications or stakeholder engagement. When you add those to the technical skills, it's magic.
Well, it's interesting. One of the topics that's come up the most in this area is the leaders we've had on talk about writing skills and how leaning into the agile workforce, the people who are ready to learn, teamwork, creativity, engagement, the ability to look at new ideas in a fresh perspective, but they all come back to writing skills, and that you need people to come out of whatever institution with the ability to communicate in a written way.
I need you, please, to ensure that that makes the final cut of this episode, because I have to play it for my sons, whom I constantly am admonishing to read and become even more articulate. It is so important. And you can't understate the critical importance of being able to represent the ideas that you have in a clear, comprehensible, compelling way in terms of your ability to actually get that thing done.
And you just did it. You did it in a clear way. You didn't talk for 2 minutes to explain that you have to be concise. I've seen that before. Is there any other messages for your son? We don't edit this podcast to take things out. Anything else you'd like your son to hear?
I think that I want to pick up a point that you've referenced a couple of times, And that is how amazingly important it is that we all think about what way we can give back and contribute to our community. I've been incredibly fortunate to have been raised by my mom, who is inspirational to me as a retired professional. She was a nurse and a pioneer in palliative care, but also as a community member. My mom has a Governor General's Award for volunteerism because she lived the value and reminded me every day to think about how I can stay connected to my core values and use my sense of who I am to be able to give the maximum possible to our community and make our world better in whatever small way I can.
One of the things I love about the career college sector, and the community colleges do it, the universities do it, but we do these, I see it every day from our 580 members across Canada, little charitable campaigns. And some of them just pop up and they'll do a clothing drive because somebody needs some stuff. Or I'll walk into a college and there's a food bank in the college, but it's really just a cupboard. It doesn't have a sign on it, but the people that are there know if they need a little something, they can go get it. And that's that sense of community that exists. Sometimes it's a major fundraiser being run by a campus with 13 colleges and they're raising a substantial amount of money. But sometimes it's as simple as having a little bit of a box where people can grab a jacket or something they need. So I love that message.
I couldn't agree more. Everyone should remember and be encouraged to remember that giving back doesn't have to be some major long-term thing. It's about showing up where you are for those around you and meeting their needs. And any kind of contribution can matter. If you don't necessarily have money that you feel you can donate, can you give of your time or of your skills? Can you just, lend someone a supportive ear? All of those make our community stronger, make us happier. The benefits are endless.
I completely agree. And I'm sure that Health Partners website is more than willing to accept people who want to volunteer and give you a hand, as are your member charities.
We love volunteers. We have the most amazing volunteers, and they're actually critical to what we do, Michael, because as we go and fundraise in workplaces across Canada, and we're in about 25 different workplaces at the moment, our goal is to double that by 2025. So wish us luck. When we go out to these workplaces to run our campaigns, we bring our volunteers who are people with lived experience of the medical conditions that our members support and or their caregivers. And they talk about what their experience has been, how the member charities have helped them overcome those challenges or cope with those challenges. Those volunteers are absolutely Health Partners' secret sauce. And so we're always looking for folks that feel able to get involved by speaking up. And so there's lots of information on our website, healthpartners.ca, and an easy way to connect with us and learn more about how you can get involved.
Absolutely. And the key is the volunteers, not the board. The board just sit around, give you ideas, and don't do any work, right?
That's been my experience.
It's the volunteers who do the work.
The board is mostly an obstruction. No, I'm certainly joking.
No, we'll bring that back and make sure the board gets a chance to listen to this podcast. We do try and have a little fun. You weren't the perfect fit to have on our podcast because you're not around the sector as much as others, but I think we don't talk enough about the intersection between healthcare, philanthropy, business, and community. So that's why I wanted to have you on, because it is a different kind of box that doesn't always get put together. But your members make a massive impact in communities across this country. They need help. COVID's been hard on them, very hard on them, and especially the ones that were so reliant on events to fundraise, right? And it's been a unique time for them, hasn't it?
It absolutely has. Demand for their services, as I said, has doubled since last year alone. And yet the funds that our members are able to raise are down at least 12% just since 2019. So it's big. The strain on them is big. And the impact that they make on our communities is big, as is the impact of your members, Michael. Community colleges. My mom was a teacher in our local community college. They make an enormous contribution to our communities on so many levels. And so I love the idea of talking about that intersectionality. And I really believe that there's so much overlap and so much that we can do when we come together around those intentions across sectors.
And I know that you're kicking yourself because I can see you. But there's there's the three sectors, but you don't live it every day. It's the career colleges, the community colleges, and the universities that we all work together. We all do great things together. And I know you're not living the language of which the different colleges are every day like we are. But we really believe that all three sectors of post-secondary education have a massive impact. And I'm really proud to see the partnerships that have developed between career colleges and community colleges and universities. These things are important and can play a big role. So let's get back to why we like to be here. And let's, as I always say, let's finish strong. Talk to me about a great mentor. Very few have been able to do one. They tend to mention two. But tell me about one of yours, and I'll tell you the fun part is you probably struggle to figure one out. Every time we've done this, I've thought of a new one. I've thought of a new person who's mentored me. And we had a very interesting conversation a few episodes ago about how a mentor, you're mentoring every day and you don't even realize it. And you're mentoring good and bad. And we had a guest on, an old friend of mine, Marlene Floyd from Microsoft now, who used to work for Prime Minister Trudeau. And her life lesson to people was don't be a jerk. Don't be a jerk, be a good person. And that was her way of mentoring people over time. So tell me, someone who was your great mentor.
I am also lucky to have many, many people who fit in that category. So I mentioned my mom earlier, and she'll always be kind of number one in that category for me. But I'm going to mention another woman who's had an incredibly big impact on my life and is perhaps a really good example of what you just said, Michael, which is you might not realize how much of an impact you're having on someone and how long that impact will be carried with them through their career. I worked for this woman, Suzanne Morris, starting when I was about 25 years old. She taught me so much about what I mentioned earlier, that ability to kind of have an intention to get something done, but to be flexible about how it got done. And that was a lesson I really needed to learn at that stage in my life. And she taught me so much about leadership and motivating colleagues. And she's incredibly brilliant and yet a wonderful mother and wonderful engaged member of our community, as is the rest of her family. I have always had deep gratitude for the impact that she made on my career starting 25 years ago. And I thank her for her mentorship. I can only hope ever to have had a fraction of the impact on someone else that she has had on me.
Well, that's a wonderful message, and we'll leave it there today. I'll just tell a little story from a graduation ceremony I was at where the valedictorian turned. There was about 400 students graduating at this career college graduation, and the valedictorian turned to someone in the class and told this individual that they were her mentor. And they wouldn't have gotten through the program without the support of that individual. So we do like to talk about, these lessons about life and skills and what are employers looking for, what are charities looking for. But every day, every one of us can have a little impact, and maybe we don't even know we're doing it. And if you could have seen the reaction in the room when the individual made that statement, it was incredible. There wasn't a dry eye in the place.
Sounds like an incredible moment.
It was a great moment. So with that, let me thank you, Kim, for your leadership, not only of health partners, but in the community. And thank you for agreeing to join us today. It's always a little daunting to do one of these things and put yourself out there. So thank you for that. And do you have any last thoughts for people?
Thank you so much, first of all, for having me here. And my last words for anybody would be connected to who you are and your core values, because that is the place in which all of us are at our most effective in any situation. And so skills, soft and hard, are equally important. And so just be who you are and think about how you can give back.
Great message. I can't add anything more to that. Thank you, Kim. Thank you all for listening, and we will be back next week with another episode of Ed Up Canada. Thanks for listening to another episode of the Ed Up Canada podcast. We release new episodes regularly, so make sure you hit that subscribe button so you know when they are officially out. If you love this episode, please leave a 4 or 5-star review wherever you listen to your podcasts so that others can also discover how a set of skills can lead to success. Thanks for learning with us.